truly there is not necessarily a lot of supplements that people have to be on. I think it's kind of a misconception.
Kuehl says vitamins and supplements generally do not have evidence behind them, but one that does is phytoestrogens. It can be found in items like soy, black cohosh, vitamin E, vitamin C, and even yams. The phytoestrogens in these items can help mitigate symptoms a woman may experience during perimenopause and menopause.
Estroven it's a brand name that's been around forever, and it kind of rolls in the black cohosh, the soy, vitamin E, vitamin C, and it's a really solid, relatively inexpensive supplement that women can take that can help, again, mitigate some of those symptoms that they may be experiencing, like the hot flashes, the night sweats, brain fog, things like that.
Kuehl says women in this stage of life can incorporate a few common vitamins and supplements into their everyday life.
We would say 1,800 international units of vitamin D and 800 milligrams of calcium daily. It's never a bad idea to take fish oil, and that dose can kind of vary on the person. The daily multivitamin, and usually with iron, as long as they don't have a problem with high ferritin or other blood abnormalities.
Estrogen has many positive effects on women's health. Kuehl says studies have shown estrogen given locally in the vagina can actually save women's lives by preventing urosepsis.
There are very protective benefits from estrogen. It can be cardioprotective for our heart. It can be protective for our bones. It can be very protective against urinary tract infections.
But when adding any new supplements or vitamins to your routine, Kuehl urges patients to talk to their doctor first, as they may cause side effects or interfere with other medications being taken.
Perimenopause and menopause are not a one-size-fits-all approach. It's very individualized per patient, absolutely.